Hello, we will discuss today a well-known condition and very less talked about is a condition which we call as a erectile dysfunction, or in short term we call as an ED. Erectile dysfunction means that when a male cannot perform sexual activity in a proper way, we call it as an erectile dysfunction. So to fulfill the definition of erectile dysfunction, a male should not be able to perform any sexual activity for a minimum of 6 months, or he has a decreased sexual activity in the past 6 months. We cannot label anyone as a having an erectile dysfunction or ED if there are certain momentarily issues where your sexual activity goes down. But yes, if somebody is having a long history, more than 6 months, and one should get himself evaluated. So erectile dysfunction is the most common problem after the age of 40, and the main reasons for having an ED in males is having any comorbid problems like diabetes, hypertension, or obesity, dyslipidemia, any drug abuse, and any psychiatric ailment, and any drugs for which there is a side effect of causing the erectile dysfunction. So when we see these patients, we usually evaluate them in detail and check out if there is any modifiable factor which we can treat, by which their problems can be sorted out. And if there is any drug which is causing their issue, we modify the dose, the duration, or replace those drugs with a newer one which has its lesser side effects. And if there is any psychological, the patient is having this problem of ED, and we modify them, counsel the patient and educate them so that they can overcome that stress, and they can get rid of this erectile dysfunction. However, when we really pick up some organic cause which is definitely treatable, and we treat them with certain factors, with certain medications, and then start a specific evaluation we call as checking the hormones, and checking the lipid profile, blood sugars, and a Doppler study of the penis to know how is the blood supply to the penis, whether there is any venous leakage, whether there is any other factor which is playing the role in erectile dysfunction. Now, once the diagnosis has been established, then we have two lines of treatment for these patients. One is to prescribe the medication other than the counseling. These mostly are the PD5 inhibitors medications, and we use them for these patients so that their problems can be sorted out. Around 90 to 95% patients do respond very well with these medications for some time, and once they overcome their rest of the conditions, their erectile dysfunction is cured permanently. Now, there is certain criteria or certain set of patients which do not respond to the medical management. For these patients, we have the surgical options which are available, or other options also available. We have some intracorporeal injections which we call as a P-shot, or some prostaglandins intraurethral, we can give them. However, these medications or these treatment options are not long lasting, and we had to choose the patients to go for the surgical corrections. And surgical corrections, we have certain implants which we call as a penile implant, and we have different types of penile implants available for different patients, with different sets of patients. We have malleable implants, which is a semi-rigid implant, and which is placed. These are the two rods which are placed in the corpora, and the patients can perform the sexual activity after placing the implants. And another type of implant is inflatable implant, in which it gives a natural sort of penis feeling after the erection, and when the penis in the flaccid state also. So the difference between two implant is that the malleable is one which gives us some sort of semi-rigid state in the penis all the time, and the inflatable implant gives a natural feel of the penis after the penile implant placement also. These surgeries are also not, they are not cheaper. They are obviously, costlier surgery, because all these implants which comes from the United States of America. So but the options are definitely there with us when our patients do not improve with the medications, and they definitely are certainly need some surgical options. So the penile implants are the options available for those patients who does not respond to the medical management of erectile dysfunction. I have seen in my clinical practice that erectile dysfunction around 90 to 95% of the time has no reason at all. They are mostly the psychological factors which just need counseling, reassurance, little bit educations, having a little bit care about your diet and your regular exercises, lessen your stress levels on your body from day-to-day activities, and have spare some time for yourself, and every function of your body will definitely improve. Thank you very much.